It's great to be here. And that was a really fabulous look at just how a program can center on making changes to really address the issue. And I think that's what both Laura and Daphne have identified and that we want to talk about today too, that there are things that we can do to address the challenges that are ahead of us. And we do have an opportunity with the federal relief dollars that is coming to states to really take advantage of a moment that we have now to not go back to the crisis that was defining early childhood education in February of 2020, but to really think ahead about what we can do now to make some of the changes that will help us really create a system that is better for kids, that is better for families, that is better for early childhood educators, that's better for our economy, for businesses. Everybody can see the pandemic has laid bare all these challenges. And I know a lot of the states that are on this call already have made substantial changes to the work that is happening in early childhood already. And so this is an opportunity and a moment to really make some of those shifts going forward. So I'm going to talk a little bit just broadly about some of these opportunities and about the context within the Unifying Framework for Early Childhood Education and the way that a few states have sort of started to make what that is. And I'm going to start to talk about some of the ways that states are making some alignment to the Unifying Framework for what that looks like to move forward. We know, I think that, you know, the combination of the pandemic itself and then the financial relief resulting from the pandemic created these sort of challenges and opportunities to advance what we all need in terms of a diverse, equitable, well-qualified, and well-compensated early childhood education profession for children birth to age 8. And this is across states and settings. And so you already heard about some of the disparities between settings where you have teachers in pre-K, you have teachers in K-3, you have teachers in childcare and family childcare, and thinking about this inclusive vision of making sure that our policies work for early childhood educators, regardless of the setting, that it is about who they are, the competencies they hold and how they get them, how they're compensated, not what setting that they're in. So we have this widespread financial crisis for families, for educators, for programs. We have an exacerbated lack of supply. As folks who know and are monitoring what's happening in their state, we have a tremendous staffing challenge in early childhood education right now. And the impact that that's having on kids, as Daphne so clearly identified in terms of turnover, where teachers are going. Some of this, in fact, we had talked about this has in some ways widened the gap between the birth to 5 and K-3 spaces. And in some ways made it even more transparent, sort of some of the disparities and challenges between those two buckets. And so thinking about what the science tells us about the birth to age 8 workforce and how to respond to that so that we're able to link those two pieces together. We know that there's an urge and a temptation in some places to look at the staffing challenges and respond by increasing calls for looser regulatory environment and lowered standards for ratios and qualifications, because we need bodies in a classroom to provide a safe or not so safe space for kids to be while their parents go to work. But I think we cannot forget that even as childcare is viewed and is a crucial work for support for families, it remains a crucial development support for children. We can't let go of the need to talk about an early childhood profession that centers the needs of children and families, that recognizes specialized knowledge and skills and competencies in the context of skilled and valuable work that deserves to be compensated because of the competencies that it holds and the work that they do. When we talk about what's going to happen and how we can transform a childcare and early learning system so that it works for everybody, I'm going to go to look at the opportunities in implementing the Unifying Framework for the Early Childhood Education Profession. And this is the document that was constructed by an initiative called Power to the Profession, which Valora was part of, which many states were part of. It was a 3-year initiative, 15 national organizations and 11,000 early childhood educators across the country to really construct a unifying framework for an early childhood education profession. And this provides us with a roadmap to move forward where we are not layering the recommendations on top of existing systems. This is really about unwinding and reorienting and realigning some of the existing systems that we have to free up the funding and focus on the workforce, to exactly some of the things that Daphne is identifying and that Valora talked about, so that we can drive access and quality. So I'm going to walk through a couple of the recommendations very quickly, just around how they were constructed, so that we can think about how states can take action to address some of these needs right now. We have an entire field, and the early childhood education profession is the profession within the field that really focuses on caring for and promoting the learning, development, and well-being of children. They're defined by the mastery of knowledge, skills, and competencies. And we've have no shortage of competencies in early childhood education. And many of your states have them. What we need is a unified set of skills and competencies that work across all states and settings, so that we can help educators, regardless of setting, regardless of how they're prepared, come through and have the depth of knowledge around the standards and competencies so that they can move forward with those. As part of the Power to the Profession initiative, a group of individuals and organizations, higher ed leaders, developed and updated a set of professional standards and competencies for early childhood educators that is leveled for the first time ever to 3 different designations. It's the ECE1, ECE2, and ECE3. The ECE1 level is the CDA, is the professional certification level. The ECE2 moves into associate's degree in early childhood education, and the ECE3 moves into a bachelor's degree. This is really an effort to say we need to reduce some of the cacophony, essentially, of what we have in terms of labels and roles in early childhood education, right? If you get 40 early childhood educators in a room and ask them what they call themselves, you might get 40 different answers. It's really difficult for educators to navigate, for parents to understand, for policymakers to navigate. And it's part of a career lattice that sort of leads to nowhere and that does nothing for early childhood educators in terms of leading to compensation. This is really an opportunity to be able to identify and provide guidance to institutions of higher education and preparation programs to be able to say, you are responsible for preparing candidates who know, understand, and can implement the professional standards and competencies in alignment with your scope of practice, so that there's a smooth and clear, consistent progression for early childhood educators to walk through their career that leads to comparable compensation with benefits, that these differences in setting and funding streams are not dictating the difference in the nature of the work being done, and that regardless of where they're working, they're being comparably compensated for that work, that it's increases with competency, which our profession doesn't do right now. We don't increase compensation with competency. Sometimes you go from earning $10.40 an hour to earning $10.55 an hour when you earn your bachelor's degree. To everybody's point, it's very hard to stay in that field and deliver the competencies to children. There needs to be an accountability mechanism, and the field welcomes the accountability that is aligned with our definitions of professional competency and that results in increased compensation. So we have this give and take of support and resources and infrastructure that comes from employers with, for example, now the relief dollars that are coming in. And yes, I have a Baby Yoda Band-Aid on my finger, which I realize you can all see now. Thank you. The employers have an obligation to ensure that their educators, their workforce, is also receiving compensation with the relief dollars coming in. And that's something we're all looking closely at. We'd be happy to talk more about. And really thinking about working with the professional preparation programs now to ensure that there is wide and unbiased access to these professional preparation pathways. And that looks like, articulation and transfer policies that folks are looking at now. So I'm going to talk a little bit just with a couple of minutes, and then I will stop and we can all chat for questions and opportunities that you all have. I think that a lot of our strategies that we're using now can be successful. And when we're thinking about, for example, increasing reimbursement rates and shifting to contracts with increased funding, whether it's through the stabilization grants or the emergency CCF dollars that states are getting, this is a strategy to advance the profession. As long as we're talking about the mechanisms in place to ensure that the funding increases are directed towards the workforce, and that there are ways to do that in contracts and grants and increasing reimbursement rates that really address that. We're looking at higher education. We can look at things like higher ed relief. There are states using PDG dollars to help higher education programs seek accreditation as a strategy to advance the profession, to think about how we address community colleges who are successfully serving what are typically known as non-traditional students, but in our field are really just students and early childhood educators, because that's how educators earn their degrees, as they work at the same time. There's investing in apprenticeships, which also sort of acknowledge the ways that our educators learn and work. When we're thinking about loan forgiveness, when we're thinking about debt, when we're thinking about all of the different strategies that we can use to transform our childcare system, in Nevada, in Pennsylvania, in Washington, and Wyoming, we've got states that are looking at adopting and aligning their state standards to professional standards and competencies, so that we're really looking at a field that has reciprocity across different states. We cannot do this with 50 different, completely different mechanisms to move. It's too hard for early childhood educators to be able to move across states and settings. If they go now, they have to start all over again, essentially. There is no reciprocity. There's room for a standard that allows for the adaptation of states to move within that. We have states that are looking at recommended wage scales in alignment with the EC 1, 2, and 3 designations like Minnesota. So they're looking at how to establish the compensation scales that they have in alignment with a pathway that moves, and really be able to put those into regulatory and into legislative language that really allows the state to move towards those. And I think working towards the wholesale redesign of financing and the structure of the childcare system in alignment with the framework, and an intensive focus on the education and compensation of the workforce, like they're doing in states like New Mexico and Vermont. I will say there's lots of different additional opportunities to look at how to take advantage of moments right now. And I'll just name a couple of those using relief dollars, and I'll drop a few recommendations into the chat as well, so that folks can look at how we're really making real the advantage of some of the dollars that are on the table right now, to be able to say, we're going to move towards increased compensation for the early childhood education workforce. We're going to move towards increasing investments in facilities that will really provide safe and secure spaces for early childhood educators to address their well-being. We can look at CCDB shifts. This is an opportunity, and I know many of your states and your administration and your states are looking at how to, are looking at the CCDF plans that are due on July 1st. There's an opportunity here to really build some of that system movement in, looking at shifting to contracts for consistency and quality, looking at paying programs as we did during the pandemic for enrollment, not attendance at one kid at a time. We can move towards stability. And as we saw in Daphne's research, stability makes an enormous difference in programs' ability to both retain educators for the good of what happens in making sure that we're able to achieve child outcomes, and being able to convey to programs that they have stable funding sources that they need to be able to increase compensation, because that's one of the things that we see. Fundamentally, we have to move towards paying the actual cost of care, and that includes compensation for the workforce. And that is really, at the end of the day, if we can't get to paying for the actual cost of care, we're going to continue to struggle in a market environment that does not meet the fundamental needs of early childhood education. It's fundamentally a public good, and I think the pandemic has revealed that to be the case. So using the resources that we have now to really move in that direction towards acknowledging the ways in which early childhood education is the public good, is a public good that needs and depends on well-prepared and well-compensated early childhood educators who really reflect the diversity of the children and families that they serve. So I will pause so that we actually have time for questions.
Lauren, thank you so much. You gave us, I was trying to jot down all the policy examples that you gave, and so many. So just know that folks will have lots of resources on our webpage, and you can certainly follow up with Lauren or any of us for some of the great state examples you gave. We're at our time. I know we've got one question from Lisa in Oregon, and we could probably spend an hour on this, but it's around those state wage scales and salary scales that you mentioned, Lauren, and how, to my knowledge, they don't affect private providers yet. They're all just sort of ideals that we've lifted up, but could you just really briefly sort of touch on how do states navigate that when it comes to, private providers?
Yeah, it's a great question, obviously, and one that I think the field has struggled with pretty substantially around. So first, I would say there are private providers that accept public dollars. So it's right, and this, I'm not telling you anything you all don't know, but private providers that participate in a subsidy system where you have the ability to say, look, if we are putting in the money, if we're paying the cost of care, you employers have an obligation to ensure that you are able to then pay your early childhood educators. And it's a little different for family childcare, so we can talk about that because there are strategies for that, but acknowledging that it's functionally different in terms of the mechanisms behind it. That you're able to say, look, we're paying for the cost of care. You're going to increase the wages as a result of that. And we're going to look and see, as Daphne so clearly identified, especially in the context of these relief dollars, it is so important to build in the evaluation upfront so that we're able to say, how do we make the changes and what impact does it make, so that we can continue to argue for more. But you're right, it is fundamentally, there isn't a solution that is solved by parents. Like, parents can't pay more, educators can't make less. We can't bankrupt the providers because then there won't be any family choice at all. It does require a substantial public investment. And so we've been subsidizing the system already, though, let's be clear. Early childhood educators are currently subsidizing the system with their low wages. So we can't ask them to do that forever. And we're seeing the consequences of that, which is their widespread departure from the field. We have to be able to put in the funds to be able to say, look, we're going to give you the funds. You're going to be held accountable for doing it. And I think that's the part of the accountability that matters, and really being able to say, okay, we're going to make it. That's part of this profession of being part of a profession that says there is accountability here, and there's obligations for infrastructure and supports and resources that come with that accountability, so that we're really able to do it. I would say so far, in terms of states imposing, we're not seeing states imposing salary schedules. We're seeing states establish salary schedules so that they can say, this is what we're headed towards. This is what we know we need. Let's figure out how to get there and make it as part of their moving forward, part of their advocacy strategy, part of their roadmap, so that that's laid out, versus being able to say up front, we're putting this unfunded mandate into place, and having providers obviously say, there's no way we can meet that without the additional supports that need to come with it.
And I would add to that, Lauren, I agree with you completely. I think that, and in the next panel, because I know it's time for that, perhaps Jason can talk about how they did this in Boston. Whereas, as we're having new funds come into the field, as we're looking to these new funds right now, building in line items that go to staff, directly to staff, in terms of payments, that becomes part of the grant, part of the transfer, that very specific line item. Because if that doesn't happen, like it happened in Boston with the PEG grants, often the money gets diverted to something else. So being sure that as you're receiving new funds, you have a direct line item that goes to staff salary.